So we got the article here in front of me. You can be able to see that real quick there. So Fauci says coronavirus vaccine trials could be stopped early if they produce good results. Insane. Simply insane. Good evening, Jenny. Good evening, April, Michelle. Appreciate you all. Please do hit the share button real quick. Please share to groups, tag people. We're getting massively censored. I'm sure this one will be massively censored or probably be taken down. So get it to as many people as you possibly can, because here's the reality. I'm going to tell you what this is done for, why it's done, okay? So they are claiming they're going to stop the coronavirus vaccine trials if they produce good results. Well, how do you see good results if you don't actually see that the vaccine protected people from serious infection, disease, and death? And how do you know that the vaccine is safe if you stop the trial early? So in the article, you'll see that the nation's leading infectious disease expert, which he's not, he gets that title because he's appointed to that position, but he really does. He has led our nation. Shoot, since he's been in office, there's been no declines, actually increases in infectious disease death rates. How is he the leading expert? And under his watch, when he's been employed by the U.S. government, we've had, again, Journal of American Medical Association, we're seeing more flu deaths than ever before. We're again seeing now more pneumonia deaths supposedly ever before in history, in our nation. We're seeing it go, well, not ever in history, because if you look at back before we had clean water and sanitation and the ability to transport nutrition throughout the U.S., yeah, we had more deaths then. But the decline happened way before vaccines were even available. And since his watch, there's been nothing but slight increases in the number of people dying earlier and earlier from infectious diseases. So he told, Fauci told, give me a second here. Hey, Ashley, can you guys hit pause on TV, please? Thank you for sharing there. Marcia, appreciate that. So in an interview, he says that, which was experts trial, the independent board, Fauci said, could decide that data is so good right now that you can say it's safe and effective right now. But animal studies, folks, this is how ridiculous. Animal studies said the vaccine was safe. Prior coronavirus vaccines were shown to be safe when administered to the animal, if that's all you did. And then you kept them in an isolated bubble cage, never infected them with anything. But when they infected them with the virus, the vaccine was supposed to be protecting them against, guess what? Severe disease, pneumonia, and death. All right? Even worse than those naturally infected. Folks, this is ridiculous. And why do we need a vaccine for a virus that has been widespread circulating for the vast majority of people having already contracted it? We don't need a vaccine to vaccinate for a virus that everybody's already caught. All right? That is insane. It's ridiculous. It's harmful. It's deadly. It's dangerous. Period, folks. So I said this back in, I think it was March, April timeframe. I said what they're going to do, mark my words, you're going to see that they're going to come out with the vaccine, and they're going to do their studies, and then they're going to stop at the end of summer, because then that's when coronavirus season starts to go up. So you don't stop. So here's what they said. They said they have a moral obligation to stop the trial early and make the vaccine available to all participants in the study, speeding up the process to make it more widely available. The participants ain't walking around with the vaccine and being like, I got it and I got the magic talisman. I've got the magic vaccine that keeps me safe and no one else can have it. Guess what? They don't need to stop a trial to give the vaccine to everybody else. They don't need to do that. So their excuse that they would have to stop the trial so that they could get it to everybody else and get it widespread in use is completely bogus. What they could do, if they wanted to be honest, they could keep the trial going and observe exactly what happens going into the next coronavirus and flu season and see who comes out better off alive. not sick, not with autoimmune conditions. Maybe they want to stop it because the animal trials on the mRNA vaccine, the coronavirus vaccine, showed increased IL-21, interleukin-21, which is a major component in a causative manner to the development of autoimmune conditions. Maybe they want to stop it before all their participants start developing autoimmune conditions, which can take months to years to develop after the initial insult, an injury, or vaccine. So they could keep on monitoring their participants and they could say the results look great. Let's go ahead and get the vaccine out to everybody. That would be actually the honest way of doing it. But no, they some reason have to stop observing the people who got vaccinated. Because if we've got a placebo, then what we have is a real scientific study that is without a shadow of a doubt going to show you if the vaccine is extremely deadly or harmful. But if everybody got terribly sick this fall and winter, if all the people, well, at least we got the vaccine out because it would have been a whole lot worse. That's their excuse they use every single time things get worse after a vaccine. A whole lot worse. Yeah, we're seeing more people die from influenza, but we'd see a whole lot more people die from influenza if we didn't have a vaccine. Common sense, though, we used to see on average 36,000 people die per year from flu and pneumonia. And then as the vaccine rates increased in America, we saw tens of thousands of more people dying from flu and pneumonia. So if you go back in history and you want to look at court cases, legal documents, things like that, and you want to watch how they put a drug on the market and then they have to take it off the market after what Forbes magazine, Pill Pushers, great article to read for everybody. It's an oldie, but it's a goodie, you know? It's kind of like wine. It's better with age, but it's still a truth that holds true today. Pill Pushers, Forbes magazine, go ahead and read it. At the end of it, you'll find out that a whistleblower says, we find out a drug is unsafe when the bodies accumulate, meaning when people die by the thousands. Now, outside of the article, you can also find other articles and legal documents and things like that, where they show that oftentimes when they want to stop a trial early, it's because they start seeing indication of harm. And if they stop the trial early before that indication of harm is statistically significant and major, what they can then say in a court of law, when thousands of people are dead and injured by their product, by their vaccine, they can say the government, the FDA approved it. The data didn't show that it was going to kill thousands, that it was going to harm so many people. The data didn't show it. Yeah, because you canceled the trial early. You didn't choose to keep on extending the trial to actually observe what happened, to give us actually solid, real evidence that going into the season, into the coronavirus season, the major season, which starts usually end October and goes through into spikes in November, December, and late winter and early spring. So if they cancel it, what they can do then is say, there was no scientific evidence showing that this vaccine is causing the severe harms to the people that it's doing. So all these people are claiming they had no autoimmune conditions. All these people sick with pneumonia and more severe lung problems this fall and winter. Well, the science doesn't show that that's caused by the vaccine. Yeah, that's because you stopped doing the science just before the pivotal moment when you would have saw the results from the vaccine, just like you did in the animal trials. They can hide. If they hide their harms, if they do not produce the science, it gives them a legal out. They already won't have liability. Our government's going to give them no liability to lawsuits. But if they have solid scientific evidence that that vaccine is extremely harmful or deadly or causes major chronic illnesses, guess what? There's zero legal liability. But if they produce and continue on with their research studies and show, and that data shows it's extremely harmful and deadly, if they keep doing that, that's the only thing that is harmful to their profits. Because then we can file lawsuits. Then we can sue the government for approving the vaccine with scientific evidence of harm. We can sue the manufacturers, the vaccine manufacturers, because they know it was harmful. But if they stop their science early, before the harms occur, just like they did in animal trials, then they walk away scot-free with their billions and trillions of dollars made off of the deaths and destruction they leave in the wake of that vaccine. Folks, there is no excuse to stop a trial when all they need to do is observe. Just watch the people. But no, they're claiming if we stop the trial, like the people doing the research study are the ones that are going to be needed to go out and vaccinate everybody. Like, we got to stop the trial because the people doing the trial and taking care of the data and tracking these the people, the placebo group and the vaccine group, they're the ones who have to go out and vaccinate the entire world. So they need to stop doing the trial and go out and vaccinate everybody. Or is it like the vaccines are like something you wear around your neck? I don't know. All the they got to give up their vaccines and they got to give them so that they can give them to everybody else. It's ridiculous. The reason drug companies have done this over and over again is so that they can hide. Shoot. You look back to things like Paxil, an antidepressant. The drug manufacturers found guilty because they withheld data that in the extended length of trial that they had data from, it was killing people. It was increasing their suicide risk. It was increasing their depression. But in the first 8 weeks, it looked like it was doing better. So in the first 8 weeks, it looked really good. So it would be unethical not to give the drug and stop the trial and approve the drug. So they did. But yet they actually stepped watching and they saw that it caused people to get worse. But they chose not to publish that data. Thankfully, uncovering those documents led to the lawsuits enabling people to get money for their lost loved ones who committed suicide as a result of the worsening effects of that drug over the long term. Things can look good in the short term, and that's really what medicine's all about, isn't it, folks? Feel better in the short term, get worse in the long term. Rob Peter to pay Paul. That's the drug model, folks. What's interesting is even Fossey mentions it. Look at this. The only time you get concerned is if there is any pressure to terminate the trial before you have enough data on safety and efficacy. Fossey, I wonder. So the hepatitis B vaccines that observed children for 4 days after vaccines, that was long enough to adequately accumulate data that showed they were safe and effective. Wow, that's amazing. I'm so glad that 4 days is all you need to do is follow children for 4 days after a vaccine to determine that it's safe and effective. It's amazing that these brilliant minds in the scientific community can say, yeah, the animal studies showed that when they were vaccinated and then became infected with the virus, that was when the severe illnesses and deaths occurred. Not right after the vaccine, but when they came in contact with the virus, the vaccine was supposed to protect them from. But we better stop our trial before the virus starts the second wave. What if the entire second wave is because of the vaccine? But mark my words, folks, they bring it to market. If it kills a bunch of people, I'll pray that it doesn't. I pray that I'm wrong. I don't want to see people harmed. To prove me right. I pray that nobody's injured by this vaccine. I pray that I'm wrong. But if it holds true like the animal trials, and when people start being infected and exposed to the virus naturally, as it circulates and people start dying, people get severely ill, more people die, they'll say it's just the second wave. We told you it was coming. Thank God we got the vaccine out in time, because there would be a whole lot more people dead if we hadn't brought the vaccine. When in reality, the entire second deadly wave could be only because you brought a useless, worthless, harmful vaccine to market. All right, everybody, share this, share. I guarantee this is going to get censored. I'm just talking logic. I'm talking about what I've seen legally or illegally done by vaccine manufacturers and drug companies in the past to hide so that they could sit back and say, well, we never had science that showed it was harmful because we stopped our trials. It looked really good. then, but we didn't want to know what was going to happen to people in the future. I'm just talking common sense here, folks. Do with this information what you will. But I'm never going to trust an organization or organizations like the CDC who's lied about and purposely committed fraud. Look it up, CDC whistleblower, Bill Posey, C-SPAN. Watch the video, everybody. And beyond that, I'm not going to trust the lives of my children, my family, my community, my church to the hands of pharmakeia, to the hands of companies who have been found guilty more times than any other criminals out there for killing people for profits. All right, folks, share this, please. Don't just like it. If you just hit like on Facebook and you don't hit share, you're not helping me save lives. And I'm begging you to help us help people think logically and see what's going on. Take care, everyone.